are you having fibromyalgia, then most probably during this monsoon season, you are experiencing more symptoms of fibromyalgia. But not to worry, there is a way out. Hello, I am Dr. Pradeep Kr Shenoy, India's first DNB consultant rheumatologist, addressing you from Amrita Center for Rheumatic Diseases in Mangalore. Fibromyalgia is a pain syndrome in which patient's ability to tolerate the pain comes down. Patient will have generalized body pain, tender points, sleep disturbances, and fatigue. Tender points are the points in the human body which will be more painful compared to other areas in the human body. And the patients with the fibromyalgia can have sleep disturbances. This could be difficulty in falling asleep, or if the patient falls asleep, there can be intermittent awakening, and further the patient can have continuous sleep and patient can have early morning awakening. So when the patient gets up, patient feel like sleeping again. This is called as non-refreshing sleep. And throughout the day, patient might feel fatigue. Fatigue is defined as tiredness which is not relieved by rest. And along with this, patients with fibromyalgia can have migraine, irritable bowel syndrome, and irritable bladder syndrome, and menstrual problems. And there are certain factors which can precipitate fibromyalgia. First and foremost is genetic factors, and being a woman, I would say being a woman is the biggest risk factor for developing fibromyalgia. This is because men almost do not develop fibromyalgia, and fibromyalgia is a diagnosis of exclusion. There are very many differential diagnoses which has to be ruled out because there is no definite test which proves fibromyalgia. Differential diagnoses of fibromyalgia are metabolic bone disease, rheumatoid arthritis, Sjogren's syndrome, SLE, etc. So one can diagnose fibromyalgia only after ruling out these conditions. And what precipitates fibromyalgia? Death of a close relative or any surgery in the patient's body. These are the triggering factors of fibromyalgia. Last but not the least, definitely gene should be present which is responsible for fibromyalgia. Not all ladies with risk factors develop fibromyalgia. They should develop fibromyalgia only when there is genes causing for it. Now, in rainy season, why the symptoms exaggerate is that during rainy season, there will be decrease in the atmospheric pressure, temperature, and increase in humidity and dampness. When the pressure decreases, the muscles, ligaments, and tendons and the joint capsules undergo stretching. So, stretching of these structures produces pain. And coming to the finer pathophysiology of fibromyalgia, in fibromyalgia, there are two mechanisms which are mainly described. There are two pain pathways in the human body. One is an ascending pathway, other one is the descending pathway. Ascending pathway carries pain from different parts of the body to the human brain, whereas the descending pathway inhibits the pain perceived by the brain. In fibromyalgia, because of the genes, the ascending pathway, that is the pathway which carries the pain to the brain, always remain in a state of facilitation, whereas the descending pathway remains inhibited. So the pain is perceived more. And any physical or chemical trauma in human body can stimulate neurogenic inflammation. That is, sensory nerve endings in patients with fibromyalgia can release substances like calcitonin G related peptide, that is CGRP, or substance P. These produce vasodilatation and they recruit and stimulate platelets and mast cells to secrete serotonin. Serotonin further acts on the sensory nerve endings and produce more pain. This is called as hyperalgesia. So, when the ligaments, tendons, and the capsule of the joints they stretch, they produce more pain because already there is sensitized sensory nerve endings. This is called as hyperalgesia. And whenever there is a decrease in the temperature, there is a vasoconstriction, that is the blood vessels in the skin undergoes vasoconstriction, and evaporation of the sweat is not feasible or difficult. To counteract this, the body tries to activate the sympathetic nervous system and increases the heart rate to pump the blood towards the cutaneous nerves and blood vessels. So, when there is sympathetic nerve stimulation, the neurogenic inflammation is facilitated. This also produces more pain in rainy season or monsoon. And whenever there is increased in humidity, the synovial fluid becomes more thickened. This will contribute to the stiffness that is experienced in fibromyalgia. Increased moisture also contributes to all this phenomenon. And how to counter this is the question. First of all, you should wear clothes which will protect you from outside cool weather. And also you can use hot bags in the painful body areas. This will help to relieve the pain. We can also apply NSAID gels, that is painkiller gels, to decrease the pain. We can apply it at least thrice daily. And you can do aerobic stretching exercises which will prevent the muscle deconditioning that occurs in the muscle fibromyalgia. And if there is overcast weather, serotonin synthesis in the brain comes down because there should be sun exposure in the eyes to produce serotonin. In overcast weather, there will be decreased serotonin production in the brain, and in patients with fibromyalgia, there could be increased melatonin production. So both of these together can produce seasonal affective disorder in patients with fibromyalgia. So to prevent this, you should go out in the daylight, not in the sunlight, because during monsoon season there may not be sunlight, but definitely there will be daylight and wind. And you can do aerobic stretching exercises outside in the daylight. This will trigger synthesis of serotonin. In neurogenic inflammation, the serotonin which is produced in the periphery will produce hyperalgesia. This again, if continues, will facilitate the transport of serotonin in the central nervous system. They will facilitate the action of serotonin transporting protein. So there will be decreased availability of serotonin in the central nervous system. So neurogenic inflammation produces hyperalgesia in the periphery, and availability of serotonin is decreased in the central nervous system. Both together can produce tremendous amplification of the symptoms of fibromyalgia. This also is mentioned in the books. And last but not the least, please review your doctor's prescription. Please follow the drugs religiously. If you are not following it religiously, make sure that during monsoon season you are following it religiously. And despite all the efforts, if the pain is not coming down, if the fatigue is not improving, if the sleep is not improving, then you can review with your rheumatologist. He will either add some drugs or he will increase the strength of certain medications. Definitely, doctor will help you, your rheumatologist will help you, but that should be the last measure. All those things which I have told in the beginning will definitely help you till you visit your doctor. And there are other pain syndromes like myofascial pain syndrome, chronic fatigue syndrome, post-infectious arthralgia, myalgia. If you have these symptoms as well, you can adopt these measures which I said. And in my next video, I will tell you how to cope up with osteoarthritis of the knees. Thank you for listening. Do follow me.